Welcome to the Mostly PT Podcast. I'm Brant Bulmer,
I'm Alex Bretzman.
and today's episode is sponsored by a raw egg.
This is groundbreaking. Breaking.
Not just any egg, great value.
A great value egg. Great source of protein. 7 grams. This is interesting. Oh, I can't watch.
One crack, everyone knows the rules.
Stay Portnoy. You missed! Oh no!
It took a lot of cervical extension.
What are you doing? I said just don't miss, and you missed.
Pretty refreshing, to be
Yolky?
honest. No, not really.
You're kidding.
Sorry.
Oh my gosh.
Here you go. I'm gonna get yelled at later.
Yell that later. I'll yell at you right now.
Very good.
Well, welcome back.
Let me just wipe this off.
Just stop.
No, I got it.
I'm coming with paper towels.
Performance was pretty subpar there.
Yeah, that was a 6 out of 10. Stop. Okay, you're making it worse. Just,
I'm not.
I can see the streak of the yolk everywhere.
Streak of the yolk.
The streak of the yolk. On my nice center table too and everything. Yeah, keep smiling. Here, throw it in there. Ugh.
Thanks for hanging with us, guys.
Welcome back, episode 14?
Oh yeah, what episode is it?
14.
14.
Halfway to 28.
All right.
Ugh. After that debacle, what did you rate it out of 10?
Oh, out of 10? Honestly, a 9.
9 out of 10?
Like that's straight pro team into
But
the
it's not the
esophagus.
highest bioavailability because you didn't cook it.
Yeah, but it's the amount of time you save. I feel like time is money.
Time is
Like,
always
you know how
money.
long it took me to cook that one egg? Probably 5 minutes.
A minute?
I ate it in 30 seconds.
All right.
All right, on the docket, we're going to start with some MBTE questions. All right, for all those at home that don't know, the MBTE is the board exam in order to be a physical therapist, a licensed physical therapist.
Brand has already passed, so he should get
Surprisingly.
he should get all 5 of these questions correct, and if he doesn't,
I will argue with him.
I'll take his license away.
All right.
If I could do that, I can't.
No, I'd have to do something illegal, but
So,
I haven't done
so these questions are from the PT365 app. You can download it on the App Store and I'm sure Google Play. I think that's.
Oh, it's an app you can download in the App Store. Nice.
Yeah, it's an app, and it gives you one practice board question.
Give me the question.
And we're just going to go back to some previous questions that I've already answered. Brant hasn't had to look at it because he already passed his board, so perfect opportunity to test his knowledge. Ready for question number 1?
It ain't going to be states, that's for sure.
Not states. We already figured out he sucks at geography. Question number 1. A patient diagnosed with patellofemoral syndrome reports significant pain in the involved knee when descending stairs. Which scenario is most likely responsible for the patient's subjective report of knee pain? A. Eccentric activity of quadriceps muscle group. B. Concentric activity of the quadriceps muscle group. 3. C. Eccentric activity of the hamstring muscle group. 4. D.
It's a step down? Stepping down?
Descending stairs.
It's A, but...
That is correct. Eccentric activity of the quadriceps muscle group. Good job. You starting off hot. 1 for 1.
Should we, explain that?
Why? You go ahead. Why do you think it was A?
Well,
Here we
stepping
go.
down. O. Right? That's eccentric of the quads.
What would be concentric?
Concentric would be going up.
Oh, okay. Now if my app will load. Maybe not. Here we go. All right, question number 2. Other systems is the category. A physical therapist works with a patient 6 weeks following total hip arthroplasty, a posterior lateral approach. The patient's medical history includes Graves' disease. Which intervention should the therapist avoid when treating the patient? A. Supine resisted hip external rotation. B. Standing hip abduction with ankle weight. C. Stair training. or D, ambulation in a warm therapy pool?
Warm therapy pool.
That is correct. Good job.
That's
It's a
I feel
basic
like-
question.
Yeah, I know.
Graves' disease is hyperthyroidism, meaning they're hot all the time.
Why not make them hotter?
Because that's bad. You don't want to make them hot.
Exactly.
All right. He's 2 for 2, folks. Question number 3. System, musculoskeletal.
Can you read the question a little bit slower for the viewers?
I'll try. I will really try. A patient reports to physical therapy 1 week status post-transtibial amputation. Which sleeping position would be the most appropriate to prevent a knee and hip contracture? A, supine with a pillow placed under the knees. B, side lying on the side of the residual limb with a pillow between the legs. C, prone, lying without the use of any pillows. Or D, side lying on the non-amputated side without a pillow between the legs.
Prone.
Correct. 3 for 3. Good job.
Wink.
You're on fire. I don't know how you did
These
it.
ones are kind of easy, but
Would you like a harder one? I don't know how I could.
sure.
I'll
Just go
try
with random ones.
He's 3 for 3 so far. 2 more for all you keeping track at home. Let's go September 23rd. Question 4. System. Non-systems question.
Okay.
A physical therapist prepares to treat a patient using ice massage. Which objective finding would be considered a contraindication for the proposed intervention? A, compromised circulation. B, acute trauma. C, edema. Or D, spasticity.
Compromised circulation.
That is correct. Now, why would you not want to use ice massage with someone with compromised circulation, Brian?
Because ice compromises your circulation already.
It already slows down your blood flow, and they already have slow enough blood flow, which would be bad. You won't want to do that.
I don't ever use ice massage anyways.
Good point. Good point. Last question. Cardiopulm. You ready for
Perfect.
this one? This one was difficult. A lot of people didn't get this one right. 33% got it right. Let's see if Branson at 33%. A physical therapist works on paced breathing with a patient who has
Paced breathing?
paced breathing.
This can be a problem solver.
A physical therapist works on paced breathing with a patient who has a restrictive lung disease. Which of the following conditions is least likely to contribute to the patient's dysfunction?
Wait, is least likely to
Which of the following conditions is least likely to be contributing to the patient's dysfunction? A.
Also, which one isn't a restrictive pathology?
Basically,
That's
yes.
the question.
A. Asthma. B. Pulmonary edema. C. A C6 spinal cord injury. Or D. Ankylosing spondylitis.
What's B?
Pulmonary edema. Can we read the answers again?
Yeah.
A. Asthma. B. Pulmonary edema. C. A C6 spinal cord injury. Or D. Ankylosing spondylitis.
It's not D.
It's not D.
Pulmonary edema. It's not B. Pulmonary edema is B.
Correct. There is asthma is A and spinal cord injury is C. C6 spinal cord injury is C. So you're down to A and C. You said the question yourself. What is
I know.
What is an obstructive?
Obstructive. Restrictive. Hold on here.
Hold on, folks.
Obstructive.
Hold on.
Okay, so the difference between obstructive and restrictive. Restrictive is usually can't like breathe, like get air in.
Can't get air in. Obstructive is you can't get air out.
Air out. So asthma, you can't get air in. I would say for the most part. I'm going with C6.
Incorrect. It is asthma. Asthma is considered an obstructive disorder. We talked about that recently too. That was a tricky one. But you narrowed it down to 2 and you had a coin flip and it just didn't work out.
Yeah, and if I'm taking the test, I just wasted a minute.
And you did. You went 4 for 5 though. Not
Yeah.
bad. That's
Not
passing.
Not bad.
Good job. You know what? That was good. Topic number 2.
All right.
Let's move on.
Would you rather?
Oh boy, we got a
good one.
A great would you rather here.
Would you rather have a 1 minute conversation with your future self or past self? And I think we have to talk about, my first question is, how far back, how far forward are we going here?
5 years, 5 years.
5 years?
5 years back, 5 years forward.
Okay. Not 10 years?
You want to go 10? It doesn't really matter. Well, I guess
Let's
it does
go
matter. 10? So I
wouldn't want to talk to me
So
as a
would
baby,
you rather
so.
talk to your 15-year-old self or 35-year-old self? And would I rather talk to my 12-year-old self or my 32-year-old self?
Yeah.
Okay, that's the question.
I feel like that's an easy answer. Well, what are you going with?
I think you have to go future.
Wow.
You going
That
past?
works for me. I'm going in the past. 15-year-old me.
What would you say? What would the 1 minute
Good
conversation?
luck.
And it's just, yeah, good luck, buddy. It gets a lot worse. So 15 years old, you're a freshman in high school? 8th grader? Maybe a
Yeah.
freshman?
Yeah.
What would you...
That's not the question.
Well, I know, but what would you say? If your 15-year-old self was sitting right next to you and you had 1 minute to say as much as you can to them, what would you say?
I'd probably be like, it doesn't really matter what people think of you.
That's deep. Good job.
It doesn't.
It doesn't. You know
Don't
what?
let the haters let the haters hate. You're just gonna play. That only takes 15 seconds. I would only need 15.
Here's what I think the problem is if you go back in time to talk to your past self, what is that doing for you in the future? Like I could go back and tell my 12-year-old self, hey, it's all gonna work out. You're gonna figure it out. You're gonna do well in school. Blah 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 blah. Life's good. What does that do for me right now? You know. But if I
Yeah.
go and talk to my future self and I come
No.
back,
Yeah.
now I know what's gonna happen.
Yeah, but we're also thinking here. This is some science stuff going on.
You could get into.
I
like,
talked to my 15-year-old self. That minute, all right, is going to affect me going.
We're
right
getting.
now.
Oh no.
Okay,
We
it's
just
the
opened
same
like
thing.
we just opened like time loopholes and stuff.
Yeah. We have to assume that when I talk to myself at 15, that's going to take an effect.
And it's
for
going
my
to it's
present
going to
self.
change your life right now because your
Yes.
past self, once you go to the past,
Yeah.
it becomes the present.
So we could talk. We could go. I could rebuttal that and say, actually, I'm going to get the effect right away from talking to my 15-year-old self because I'm going to go back to myself. You talk to yourself 10 years down the line, you're going to have to wait 10 years before you know what's happening.
Fair, but what if the conversation that you have with your younger self completely changes where you are in life when you come back?
That's the
to
whole
right now?
point of having a conversation with my younger self. I'm not going to. You think I would want something to stay the same? No.
If we
I'm
have
gonna-
these variables in place and I think about it, then yeah, I guess so. Because if you go into the future and you talk to yourself, then you already know what happens. Then it's like, well,
There we go. I'm talking him into the right answer.
I'm getting more. 5 years, I think I go future. 10 years, I think you can go past.
Also, if you talk to yourself in the future, what are you going to tell yourself in the future? Or are you going to?
Yeah,
You're going to
I
be
get-
asking questions. You're going to be asking questions.
It's a 1
because you
minute-
need to know information.
It's a 1 minute.
That's the
okay.
thing. You get to know information, right? You get to know information that happened 10 years in the future.
Mhm.
If you talk to a 15-year-old me, right? That just takes an effect for the present me. Okay, so I get those effects. You just take in the information that they give you. You get 1 minute. I get a 10
But
years.
it works.
Of
It works
I
the
get a
same
10-year
way.
effect. You get 1 minute.
It
effect.
works the same way. Because what if your 30 or your 10-year-olds, your
This is
10
good.
years
We're
far,
really good at math.
the 10 years farther, if you go and talk into the future, when the time that you get to where that point is, it could be completely different.
1 minute is not going to change that much from. I don't think it's going to have as much of an effect.
We just opened up
unless 10 years in the future yourself really has some grand information that happened in 10 years. What, you're going to be a physical therapist? Hey, you passed your boards. Nice.
What if it's like,
Well, compared to a 15-year-old me that's in high school, right? The change from 15-year-old me to here, big change. The change 10 years down the road. Oh, I'm still a physical therapist.
yeah, but you're still developing as a person. You could be married by then. What if you go into the future to talk to yourself and they give you yourself gives you a certain piece of information that makes you change your life and nobody else does it? You know what I'm saying? Like,
Yeah, like what?
I don't want to get into like money or something.
I mean,
but
yeah,
like,
you could do lottery.
what if it's like invest into this company XYZ, and
Yeah.
you would have never known that?
That could be vice versa.
I think you could
There's
go
no
both
difference.
ways. I think you could go both ways.
Yeah, I'm sure it's a would
But-
you rather, so really you could.
It's a 50-50. The more you talk about it, the more I think past self is better, though. but I don't know what I would say to my past self because I would be scared of what the changes would be when I get, you know what I'm saying? Like after the conversation happens and I come back to the present.
You're just messed up.
Yeah, like what if my life is like, what if I'm no longer in physical therapy school, you know? Like what if I'm in a complete, was it for the best? I don't know.
We're kind of getting deep here.
That's a deep question.
But I definitely would go with the past me.
I think I have to agree, but I think it would be interesting to see future self because I think you would learn more about what you need to do to get to where you want to be.
Okay.
You know? Anyways, that was the would you rather section.
Here we go.
Sorry to get deep on you.
It's getting juicy here.
Now we're getting some stuff.
What sport takes the most mental toughness? And if you could think back, we talked about what sport is the most skilled. Now we're talking about the brain. All right, what's the most mental toughness wise? All right, you're grinding it out. You're.
I'm sorry. You got Kleenex on your chin from the egg.
You're just now.
Can I
telling
get
me?
it?
See, I would say to the 15-year-old me, don't do that.
Don't eat an egg on your 14th episode.
Is it
of
gone?
Your pod. Here, let's do the mom thing.
No, you're not touching. You're not doing.
Yeah,
it. Where's it at?
You got it. You got it. It was on your left and to your chin. Yeah, you got it.
Left into your chin. All right.
Okay, sports.
All right.
Most mental toughness. Right off the bat, you have to think of individual sports, I think, where you're basically competing against yourself. And I think you could argue that golf is you need the most mental toughness in golf to be able to succeed. Because it is a team sport where, like, if you're in high school, you're in college, you're on a team of 4 or 5, whatever, and you need to do well with your other teammates to score as low as possible. But let's say you're doing it recreationally and you want to get better and you're going out by yourself, the amount of mistakes you are going to make is like insurmountable because golf is extremely difficult and the amount of hand-eye coordination it requires.
We're not going difficulty here.
I know, but I'm just saying the amount of difficulty it requires is going to beat you up mentally when you're like, I'm no good at this. Like, man, you score bad on a hole and you carry it with you for the rest of the round, your round's going to suck. But if you're able to, let's say you triple bogey hole number 1 and you're like, all right, hole's over, you go par the rest of the hole, you shoot 3 over, pretty good day.
Okay.
You know, I think golf is a very good answer.
I think it's a crappy answer.
You think? Okay, what's your answer?
Okay. First off, let me talk about golf for one.
Let's talk about
If you miss a putt, right?
it. Mm-hmm.
You miss a putt, right? Oh shoot, I missed a putt. That does affect you the rest of the game, right? Is that what you're talking about?
Yeah.
Like, if you're off kind of thing.
Right.
Right? Now, let's take a sport like wrestling, right? You have to cut, you have to maintain a weight. All that, that's a lot up here.
Yeah,
you know how
but
hard that is?
I think it does
mentally, when you're mentally dehydrated, mentally dehydrated.
You're physically dehydrated.
Yeah, you're dehydrated in the brain, all right? I bet you there's some water content that's leaking out a little bit, all right? I don't know for a fact, but that, and also maintaining your same weight, and also going into the wrestle like that, that takes, it's hard physically, but mentally to do that, that's insane.
You're
Compared
correct.
to you missing a putt.
You're correct.
Big whoop-de-doo.
Grant, you're correct. But here's the thing: we are arguing two different things.
I'm
not even arguing.
It's mentally.
You're saying.
Why do you think it's hard for people to maintain a diet? It's mentally hard to maintain a diet.
I'm trying to I'm saying
you're right. I'm sorry. This
Just
is bad.
let me make my point.
I will let you.
Let me make my point. You are saying the physical components of the sport will take a toll on you mentally. I'm saying the physical errors of the sport will take a toll on you mentally. And we're talking about mental toughness.
It's the same thing, different situations.
It's making a mistake.
They're different sports, so it's going to be different.
It's making a mistake compared to pushing your body to the limit. That's what we're arguing right now. And I'm saying, by the bias of the question, that making a mistake is what you're focused on when it comes to mental toughness. Yes, wrestling incredibly hard for you to be able to stick it out. Hey, I got to cut 6 pounds to make weight by Saturday. That's really hard to do. And not only is it physically incredibly hard, but it takes a toll on your mind. And why am I doing this? Why do I keep showing up? Why am I physically harming my body to be able to go do something that I like? Where I'm taking, oh my gosh, I just sliced the heck out of my drive onto the next hole. How am I going to recover on the next shot?
Slice the next one.
Right, because if it's in your mind, you're like, I just sliced my drive. I'm going to hit a crappy second shot. You're going to hit a crappy second shot.
So they're both hard, mentally tough in different ways.
Sneaky answer here is baseball.
Okay, here we go again. Baseball.
Baseball is a sport. The best baseball players in the world fail 70% of the time at the plate. Could you imagine in your life if you were going to do a certain amount of tasks and you failed 70% of the times at the things that you did?
You're talking about elite players, though. We're talking about just sports in general.
Oh, in general, your average 75% of the time for average, 250 compared to 300.
And you take some average person off the streets and tell them, hey, dehydrate yourself and maintain this weight. That's going to be hard. Also, why not? Okay, you're picking golf, right?
Mm-hmm.
Why not pick croquet? What's the difference? Why golf compared to like other sports like it? Croquet, I don't know how you say it, but that's kind of the same thing.
Crocheting. I think golf.
Oh, you missed a croquet.
I think golf is harder and more physically demanding. It's way more.
We're not talking about that. We're talking about mental toughness.
I'm saying there needs to. You're right in the fact that there needs to be a physical component, but you can make if you're going to say wrestling, I can make the argument for football. It's a fourth quarter and you've been beaten up all game, and you got to get in your mind like, all right, I still got to do my job. I got to go block this guy.
Yeah.
I mean,
you do that for 60 minutes compared to a month of maintaining the same weight, not drinking any water. Okay, longer than a month compared to 60 minutes. I like your answer with golf, though.
We're both correct, but we're debating different points.
We're debating different points based off the same point.
Kinda. I mean, it's like I said, you're taking the physical component and I'm taking the mental component.
What do you guys think at home?
Let us know in the comments.
Yeah.
What is the most mentally challenging? What sport requires the most mental toughness? I think it's golf, and I think I make a good argument. You also have to consider the fact, what if you're really, really good at your sport? Like, let's say you're an expert at cutting. Like, let's say you can lose 8 pounds in 4 days like nothing because you've done it so many times before.
Okay, yeah.
And let's say you're a scratch golfer and you can go out and shoot even par no matter what. I
don't know where you're going with this, to be honest.
I'm saying
we could take every variable there is and answer this question. I think we need to move on from this.
Final statements. If you're really good at something and you screw up, it takes a lot of yourself to say, hey, I'm still really good at this, and to put the failure behind you and move on. That's what I'm saying. And that's what I think I'm getting at the golf thing, is you see professional golfers have a bad hole and they wipe it and they still go win the tournament. That's mental toughness. Be able to say, that happened, I'm putting it behind me, it affected me, I'm not going to let it impact the rest of my round. That's what I'm getting at.
My last thoughts.
All right, closing statements from Brent.
You haven't had water all day. Someone goes, hey, look at this nice Pure Life water bottle, and just lets it drip, drop, drop.
Oh.
And you're like, you know what? I want some of that water, but you can't. That's mentally tough. Thank you for our TED Talk.
That was I think one of the best Would You Rathers ever. If that doesn't incite some type of like internal thinking and like at least a couple comments, then what are we doing here, you know?
Yeah. If we don't get any comments on this, mostly BT Pod out.
We're wrapping it up.
All right. PT topic of the day.
18 minutes later. That's a good guess.
Yeah, I don't really know.
We're called the Mostly PT Podcast. We should maybe be called like the
Seldom PT Podcast.
The Little PT Podcast. The 10 minute whatever.
PT topic.
All right.
Posture.
Does posture matter?
Posture.
What are you doing?
I'm just doing like a posture. Okay.
That
was very kyphotic.
Okay. This is my argument with that.
What are you? I'm not. We might be on the same side here. What does posture matter? That's a question, right? Let's start it off easy. Does posture matter?
No. But in some
Why,
cases,
Alex?
It doesn't, because if you find this position to be comfortable, you're fine. Some people find different comforts of, okay, if I sit up straight and tall, I'm comfortable like this. Some people slouch. I'm a natural sloucher. When I'm at school or whatever, taking notes, or if I'm doing homework or writing anything, I'm constantly like this, and I find comfort.
Yeah, I could sit here the Hunchback in Notre Dame right now.
I could sit here for an hour and be fine.
Yeah.
And then if I need to make an adjustment, I do. And that's not saying that I need to have perfect posture to be able to relieve my pain, but it's saying I can make tiny adjustments where maybe I'm not like so forward head, or maybe I just move my head back a little bit. I'm still not perfectly straight up and down.
Well, my question is, what's perfect posture?
if you want to get like in like the draw the string line down with the ears, and
Yeah, how'd they determine that?
they put lines down the ceiling and they had people stand and they figured it out.
Who decided that's perfect posture?
Some people in the 1950s, 40s, 60s, something like that. Early PTs.
Do you know when posture was a thing? Like how it came up of?
Not really.
The military.
Really?
Yes.
Because of standing at attention?
Yeah.
Oh, okay. That makes sense.
So really, it got what's the word? I'm twisted and thwarted. That's not a word.
Thwarted?
Of like into, oh, you have bad posture. That means you must have pain, right? Or, oh, I'm coming in with back pain. My posture's bad. What I say to people, your next posture is your best posture.
That's a great saying.
All right? You know what? You sit like this. It's not the posture that's the problem. It's the time you spend in the posture. I could be like this for 10 minutes, 20 minutes. Yeah, it might get a little sore here to sit like this. Also is true. I'm sitting like this for 10 minutes. Yeah, I might get a little sore. The posture itself is not the problem. It's the time you spend in the posture.
Okay.
That not for everyone. I would say that's the thing. Now, I feel like there are situations where posture does matter. I would say for function.
Okay.
For example, you take someone that's very kyphotic.
I think
what's kyphotic?
Okay.
This.
I think that was my one
Yeah.
point is the only time it matters if someone is extremely kyphotic.
Yeah, so extreme. So like this. If I'm like this, and Sally has problems reaching into the cupboard and grabbing a dish. Well, if you're like this, oh, Sally can't get the dish. Okay, well let's try to get straight up. Not saying, hey, that's a good posture. We'll just say, hey, let's change positions. Let's try to be more straight up. Hey, look, I can reach higher.
So basically, posture matters when it is starting to affect your activities of daily living.
Yeah.
I can totally agree with that.
Yeah.
And I think you're correct. I think there is no perfect posture. I think we're right when we say that. But you kind of agree with my point when I'm like, I can sit like this all day, and then maybe I get a little bit sore and I readjust. It's the tiny little readjustments to make yourself comfortable is what's important about posture. Not being perfectly in line and having your spine straight and your ears through your shoulder and all the way down to your malleolus if you're standing. It's
your ankle.
What is comfortable to you is your posture. And if your posture doesn't bring you any pain, then I think it's completely fine. And if someone's like, oh, you need to sit up more straight. Obviously, there's like times where you probably should be at a tent or be a little bit straighter up to show that you're paying attention or something. But
yeah,
I think.
And the way I don't talk like this like I do in the clinic. Like if someone's really like, oh, my posture. Day one, I'm probably not going, posture doesn't matter. I'm probably just saying, hey, well, if you think posture's a problem, then let's change postures. So, like, you kind of go into they're probably not going to take it well if you go, you know what, actually, posture was made in the military back in the day. No, I'm not going to say that. I'm going to say, okay, well, if you think posture is a cause of the problem, okay? I'm not going to say I agree, like, yeah, it is. I'll be like, well, let's see how it feels when you do this. When you sit up, does that change? If it does, great. I'm not going into like the depths of what posture is.
I think where I've seen it in the clinic on clinical is where someone is kind of hunched over and kyphotic and it's bringing them on pain, and just that tiny adjustment or reminder, like every 15 minutes, just be like, oh, I'm kind of feeling pain. Try to sit up.
Yeah.
And then they're like, oh, it feels a little bit better. And then over time, because our natural body position, we're just going to slouch more forward because we're typing. And then they're like, okay, reminder, 15 minutes went by. What am I sitting? Okay, I'm hunched over. Am I feeling pain? Yeah. Okay, let's adjust.
Yeah.
That's the biggest thing when it comes to posture, I think. I think we both agree on that too. And I think it's a common thing and it's an important thing to know. Does posture matter?
If it matters to the patient, I feel like we should take that into consideration.
It matters until it doesn't. Or it doesn't until it does. It's a play on words.
Put that on your fridge.
But it matters until it doesn't, and it doesn't until it does. Just like everything. Does knee pain matter?
This is
not until it doesn't. I don't know.
Okay, well,
we got
one other point here.
Oh, okay.
Posture, and I would say some people also think of not just pain, but like the looks of it.
Right? I think that's
like
almost
aesthetically.
I think that's the bigger point that you could even argue that if you're hunched over, you look like a
Be careful.
No. Like, you're less productive as a human almost? Like, you look like you don't have it all together,
No,
maybe?
people just don't. It's kind of like I don't know. When you think of this, like maybe this isn't the best. I don't want to say best looking posture.
I think you're right.
Like aesthetically, like this is just when you're talking to someone, people don't. I don't know. I want someone to like kind of.
This is like kind of giving off like I'm frail, I'm weak,
Or
like
a
that kind of thing.
big hump on their neck, right? So like
if you're having
that's harder. I feel like that's a harder conversation or a harder thing to change because you can't really change like someone's kyphotic thoracic spine.
Right.
I don't think so, unless you did some kind of long duration stretching or something to where they're in a certain posture for a long time, maybe. But I don't know how. Like if that's even
All right, we got to simulate this for the next minute. Nope, straighter. Yeah,
that was out of pocket.
we did it for 3 minutes. Like showing you're actively listening, like not here, but being at a tent. I think that's like what people.
That's usually not the problem people are walking in for, though.
No, it's when if they feel like, oh, I have bad posture. It's usually because they have pain. It's not like, oh, I have bad posture, and people think that I don't listen to them and I'm not paying attention and I don't do any work. That's not what they're coming in for.
Yeah.
Pretty good.
Yeah.
That we tackled most points there.
I think we did. We missed a couple tackles, but
you know what? You got to take a shoelace tackle when you can get them. That was my specialty, way back when.
All right.
They called it the Alex tackle. You dive at legs and then they fall over. That's a great tackle.
Star kid making a star tackle. This has been episode 14. Thank you for tuning in with us.
We'll see you in the next one.